Hello, welcome to the treatment group video for brief psychotic disorder. I am Dr. Noni Perkins-Moore, and my client is Mitzy Bartholomew, who is 52 years old. The differential diagnosis for this client is brief psychotic disorder and delusional disorder. Delusional disorder was ruled out because the client has been experiencing symptoms for less than a month, and her behavior is not obviously bizarre or odd, and for the most part functioning is not impaired. The primary diagnostic features for this client or for brief psychotic disorder is a person with this disorder experiencing delusions, hallucinations, disorganized speech, or grossly disturbed or catatonic behavior, and the symptoms are present for less than 1 month. Now a little bit about Mitzy Bartholomew. She's a 52-year-old rich white lady who is an active member in charitable causes and cultural interests. Growing up, she was loved and doted on by her parents, but she longed to have a sister. She fulfilled that longing by or through her best friend Christine, who she met in college. Recently, Mitzy has took on a lot of work challenges, such as overseeing the construction of a new cultural center in her city, which is highly demanding. And then on top of that, she's been worrying about her workers going on strike, contractors giving unfulfilled promises in delivery, and then dealing with a volatile, demanding interior designer. And then on top of that, on top of everything else, Mitzy decided to host a dinner party for her husband's law firm. The dinner party is just horrible because the chef had to leave and the replacement chef is incompetent. And then to put the icing on the cake, she got word that her best friend died, specifically decapitation due to a car accident. Mitzy collapsed and was rushed to the hospital when she heard about this. She was treated and then released to her husband's care. So then 2 days later, Mitzy attended the funeral, and she was characterized as being tense and jittery. She had been getting little sleep, 2 to 3 hours to be exact, each night. Her husband started to notice a steady decline in Mitzy's cognitive functioning. She had difficulty concentrating, and when speaking, her words and her sentences would trail off. Never really completed any one thought, too. So the day after the funeral, Mitzy and her husband were walking down the street when Mitzy startles and points they were walking down the street and Mitzy just was startled and was pointing frantically to a car passing by and claims that the woman driving the car was her best friend Christine. She immediately becomes convinced that the car accident that took Christine's life was just staged and was part of a plot against her. She believes that this deception is part of a greater plot to kill her and that she is in grave danger. She is suspicious of everyone except her husband. She pleads with her husband to help save her. She refuses to allow any cell phones around her, as she is convinced that they are bugged and in order to track her every movement. She begins to hear high-pitched, undilated sounds, which she fears is an ultrasound beam aimed at her. I know, crazy. And she is in a state of sheer panic, gripping her husband in terror, and he brings her to the ER the next morning. Mitzy was then admitted to the psychiatric ward, and after 3 days of treatment, she begins to show significant improvement. She no longer believes that Christine is alive, and while still slightly suspicious, she is able to acknowledge that her fears are just ridiculous, So, moving on to the multi-axial diagnosis. For axis 1, I put brief psychotic disorder. For axis 2, I put none. She does not have a personality disorder. For axis 3, I put none. There's no medical information that correlates to her disorder. And then for axis 4, I put recent death of best friend due to a traumatic accident and work stressors. For axis 5, I gave this client a GAF of 46. Moving on to the theoretical perspectives, I have biological perspective. The client may have a genetic predisposition because occurrence rates are higher in families with the history of depressive and bipolar disorders. Also, the client may be experiencing an excess of the neurotransmitter dopamine, which explains the client's psychotic symptoms, the delusions, and hallucinations. According to the diathesis stress model, given certain stressors or triggers, certain genetic predispositions will manifest. So in the client's case, she has been exposed to a lot of work and social stressors that may have triggered the psychotic disorder due to a genetic predisposition. Moving to the next perspective, sociocultural. Since the client has been exposed to a lot of work stressors and social stressors, the death of the client's best friend was too much for her to handle, so the client's genetic predispositions manifested, which resulted in the psychotic break. So that is all for this treatment group video.